Yeah.
I know. It's just confused if I got to this. What's and then
That's right.
and then
Is that okay?
and then we just forgot one thing.
Then do we have to switch the order again?
It is. I just most quickest. Okay.
Okay, good.
Can you all hear us remotely?
Yes.
Yes, thanks, Lily. Yep.
Right. So we're on to our final couple of sessions. So we're just going to talk briefly about accessing Optune and support. And then the final session for the day is a Q&A, and that's really just a free-for-all for any questions people have got, any comments or anything else.
And the only other thing I will say is I am going to reshare the Mentimeter I put at the beginning of the day for you to put one word or one thing that you've taken away from the end of the day. So I will put it in the chat now so you can access it again.
Cool. Yeah, so please do, just before, please do the Mentimeter and please do give us feedback. So although this day is quite similar to last year, it has actually changed probably more than people might realise. And based on the feedback, we will try and evolve the day again. Okay, so we just thought that we talk about how people can access Optune, what the practical issues are. That might not be relevant for everyone, but as long as people know the basics. So the first thing to say, well, actually the first thing to say is that Optune is available in the UK. Now that might sound like a very simple thing, but until quite recently, I had some colleagues and patients telling me it was not available. Okay, so Optune is available is a first step. The second thing is that Optune is expensive. And just to be clear, if you just get the self-pay price, it is about £18,000 per month. Okay, and of course you wear Optune for many months and therefore it ends up being very expensive. Novacure may be willing to discuss price reductions. To be clear, I do not work for Novacure. I'm not empowered to speak on their behalf, and I definitely don't get involved in price negotiations. My feeling is that if you were to go to Novacure, having paid for Optune for a period of time and then you ran out of money, they might not remove the device from you. What they won't do is they won't give you the device for free because they're a commercial company and it actually costs them money to deliver Optune. So Optune is available. Optune is expensive. It is a hassle, but it's tolerable. And it's covered by some insurers. At the moment, the two big ones are Bupa and Aviva. There are some small ones, Cigna and Allianz, I've had approvals from in the past. We know that AXA and Vitality won't cover. If there are others, you know, if there is a few other small insurers I've not had experience with, so I don't know about those. The other question we get asked is it available through trials? So at the moment, the only Optune trial I'm aware of is Herban's trial in Manchester, which is pre-operative Optune and is in a very small number of patients. There will be the upcoming trial, which is the EF41, where everyone gets Optune and the randomization is to pembrolizumab or not. That will be for newly diagnosed patients. The problem with that, though, to pick up Kathy's point, because Optune is not routinely available in the UK is a relatively unattractive place to run EF41 because the company has to pay to provide the Optune and run the trial. If you were running the same trial in Germany, you'd have to pay to run the trial, but the Optune itself would be funded because it's routinely available. So one of the problems with the NICE decision is it makes the UK an unattractive place to run trials of Optune. To put that in context, Trident, which was the last big international trial that closed, recruited 950 patients, of whom fewer than 20 were from the UK. So that's bad for UK patients. It is bad for the UK life sciences. It is bad for the UK economy because you get paid quite a lot of money for recruiting patients into commercial trials. The next thing to say is that the UK Optune support group is available to all UK Optune patients, irrespective of who their treating oncologist is or whether they are self-paying insurance, trial, or any other mechanism. Okay. And I would very strongly encourage you to, particularly the healthcare professionals, to send your patients along to the Optune support group and for patients to tell other patients about it. The Optune support group meets monthly on Zoom, but there's also a WhatsApp group as well, so that patients can get better time support. Okay, so that's kind of some of the support that we can offer. And if people are having real Optune problems, I mean, I'm always happy to kind of have an email exchange or pick up the phone if people are really stuck. So how else do we improve access to Optune? More trials are definitely one way, but as I've said, the UK is not necessarily a very attractive place to do UK trials, and what else could we do? Well, I've applied to NHS England, who said it should be appraised by NICE, and as we have discussed, NICE doesn't want to appraise. It is worth saying that even if NICE turned around tomorrow and said they would appraise it, their appraisal process takes 2 years. So that's realistically, this is not going to change anytime soon. And it's probably worth being honest with patients about that. So it is not the case that we are going to get Optune approval, you know, in 2025. Like that, the timelines on that aren't really feasible. So this is just the Optune support group. It's run by myself and Lillie and Shahabi, who can't be here today, who was our senior CNS, is now our trainee nurse consultant. For those of you familiar with a brain tumour support group, it's basically modelled on that, but it's online. And we split it into 2 groups. There's a closed support group, which is a fairly standard patient support group and works like most other patient support groups. And then we offer an open section, and that's half an hour afterwards. And we normally ask a couple of patients to stay on. We've never had a session where we haven't had patients stay on. And any patients who are interested, any healthcare professionals who want to ask questions of patients can come along to that, and they can have half an hour to ask practical things. And I think that that's really useful. If you've got patients, I think, Faye, to pick up your point about how do we talk to patients about Optune, but my best piece of advice is to get them to come to the open session and get them to talk to existing patients and carers. I think that's much more useful than talking to me, for example. And that Optune support group really is about encouraging shared learning between and amongst patients and carers. So there's lots of shared practical tips. There's lots of psychological support. And at the moment, we're meeting once a month with WhatsApp in between, which at the moment I feel is about right. And then the other major bit of support that we need to talk about, and we haven't really talked about much here, is the device support specialists. So those of you who've not prescribed Optune may not know that when you prescribe Optune, basically you sign a PDF and send it off to Novacure. And what they do is they arrange to ship the equipment to the patient's home, and then their DSS comes and sees the patient at home. There are currently 2 DSSs in the UK, Sue and Musa. Musa covers the southern bit and Sue covers the northern bit, although they cross cover when they're on holiday. And they come into patients' homes and they help set the patients up using Optune. And I will say that we have had routinely excellent feedback about the DSSs. I think the DSSs are really, really good at helping patients use Optune. And I think that sounds like a really minor thing, but it's incredibly important. They'll normally set them up, ask them to shave their head the day before they visit, help them put the arrays on the first time, make sure they're all connected up. And then they normally go back 2 to 4 days later when they're doing their first array change to make sure that everything's all right. And then in addition to that, we have the Optune support group and the Optune WhatsApp group. On a personal basis, when I prescribe Optune for someone, whether it's on trial or privately, I normally ask to see the patients 3 to 10 days later, because that's really to make sure they've had a few days on Optune and they've done at least 1 array change. And I think that's a really useful time to catch up with them. And the reason I do that is because about 4 years ago, a patient's wife told me that she thought the most important thing is actually how you got started in that first few weeks. And indeed, there is some data on that. I didn't show the data in the slides, but one of the things the X-Cures study showed is that your wear time in the first month of use significantly predicts how much you're going to use it going forward. So there is a real thing about when you get started with Optune, doing it properly and making sure that patients are supported via the DSS, but also medically to use it at the maximum amount. The other thing to say is the DSSs are employed by Novacure, and therefore all of their advice must be governed, for example, by the license around the device. As I said earlier, I'm not. So the device specialists, for example, cannot advise on what creams to use because they're not medically trained, so they can't give that advice. Whereas we can. And, you know, if you look at Catherine's slides and have a think, there's normally some fairly simple advice that we can give, which will solve, my experience is I expect to be able to solve 60 to 70% of most patients' skincare problems. And then the remainder 30% have to go and see Catherine. That's kind of useful. Okay, so that was a quick run through in terms of access and support. Are there any questions about that? Oh. Okay, any questions from in the room about support? Okay, I think either I've stunned everyone into silence or they've got no questions. Yes, sorry. Yeah, so the question is patients who are thinking about Optune, that is what the open group is for. So we don't let them join the closed group because the closed group is meant to be like any other brain tumour support group. It's a forum for people who have shared experience. The open group is exactly for that. So if you've got patients who've got questions, I mean, you know, they can ask you, they can ask me, but I think it's more valuable to get them to talk to other patients. So that's what the open group is. It follows on directly after the closed group. So typically the closed group is 5 till 6, the open group is 6 till 6:30 as a typical thing. Yep. So for those of you who didn't hear remotely, the support group is obviously free. We just ask people to register on Eventbrite and then we can send you out the Zoom link. Oh, yeah, there's a question from Driti. Do you want to unmute yourself?
Yeah, actually more of just a comment. And of course, thank you so much for the session. It's been incredible, and also it's crazy the kind of work that's going in to increase access to a small number of patients. I know that, you know, somebody said earlier on that, oh, now, you know, lung cancer patients have increased, so the economics will work out. But that's really unfortunate that the number of patients will have to increase for this to make sense. So I think, you know, whatever we can do to help, I think we will. And I think there's just one other comment I wanted to make. I think somebody was talking about, you know, it being the device itself being a constant reminder of the treatment. And I think, you know, the way we've been looking at it, I'm 31. So it's also, and I think it might vary across age groups, but it's also sometimes it just feels like a constant reminder also of the fact that you're trying to help yourself, and you're actually being able to do something about it. Because of course, in the universe of limited options, as we've discussed extensively, at least this feels like there's something actively happening to try and contain the situation and give you another day of life.
Yeah, and I think it's a really interesting point, that thing about reminding people about the brain tumor. My experience is that most patients don't forget that they have a brain tumor. And so most patients I talk to, I think the Optune is more about they feel like there's an ongoing treatment that they can deliver at home. I think there's some degree of kind of locus of control. It's a treatment that you get to do yourself at home instead of something that someone does to you, which I think is of benefit. Any other questions about access? Or in that case, we might have just fades into the general Q&A session then, so that's pretty easy. Fine. So I mean, in that case, we are pretty much at the end of the day. So the only thing I would ask is please do the feedback form that Lillie has put in the chat, because it does help us improve the day for next year. And then really now is there an opportunity for you to ask any other questions if you have them. So please speak up, ask your questions. Very happy to answer anything really if people have any questions. Okay. Also,
Don't know who wants to answer this one. I don't know this one response. Genome sequencing and immunotherapy. How far off is reality versus therapy?
Genome sequencing.
well,
In the UK, sorry, everyone have probably German.
so the background to this is Genomics England introduced whole genome sequencing. But what they didn't do is they didn't provide any funding for any of the clinical staff time associated with it. So Lillie does our whole genome sequencing paperwork. Takes about 90 minutes per patient.
So basically, I think the longest part of the whole process is the coordination element. So paperwork is one thing, and I don't mind paperwork, as Matt does often send it my way, but it's more, we need to see, it's the coordination between the histopathology department, the patient itself, the MDT, like the treating clinicians. So do we have enough tissue that is allowed to be dispatched to Genomics London? Believe it or not, the biggest barrier I faced with one patient I did consent was getting it from hospital X to hospital Y, which were 5 minutes walking distance, which there was a barrier between that. That was the biggest barrier.
So yeah, so in terms of the whole genome sequencing, most patients are still not having fresh frozen tissue taken, because that is additional work and it's not funded. That's never been funded in the NHS. And then even when it is 90 minutes to 2 hours work per patient to sort out the sample movement and the paperwork, and that isn't funded either. So Genomics England get to go, we're offering whole genome sequencing without actually thinking
And it's an
about
additional
how you
consent
do it.
form for the patients to sign as well as the terms and conditions, which me and Matt call.
Yeah, it's
It's like a phone contract.
Yeah, it takes quite a lot of time to do with the patients. The separate thing, and the other thing
I will say
hang on a second. The other thing about whole genome is until recently there hasn't actually been any clinical benefit from it. So you could kind of do it, but it was like, well, why? The big thing that's changed is the 5G trials coming along, which is a trial for relapsed glioblastoma, and part of the entry criteria for that is you have to have had whole genome. And actually, the nice thing about that is you can now say to your surgical colleagues, for example, I really need you to do fresh frozen because I want the patient to get into 5G in any month's time.
And can I say it from another perspective? So I guess the way I now see it is, in order to make anything a change, you need to start somewhere. And I think it's about identifying where the problems were. So I think initially it's facing the problems, which were the little bits of getting the tissue from X to Y, getting the patient. That was the easy part, to get the patient to sign along. Getting clinicians on board was quite good. But I think what we're now trying to do is we've set up my own telephone clinic so I can talk patients through that. But we're now trying to do it in a more prospective manner. So it's no longer patient, I've had the operation, do you want to be part of whole genome sequencing? Is there enough tissue? We are now seeing patients who are going to be going for an operation, so just at the newly diagnosed element, so that we can start the paperwork and then do that. But I think the only other issue we did have at the beginning is not knowing the turnaround times, and that uncertainty, it makes you a bit worried, because what do you tell the patient? Is it 3 weeks? Is it 6 weeks? Is it going to benefit you? Is it not? So it's all those uncertainties, but until you start doing it, you don't really know what to face.
Yeah. And then just to pick up your second bit, immunotherapy. I mean, you know, at the moment, there's no good data. CGAP published their paper, must be 3 months ago now, of which I was a minor co-author. It's non-randomized data, which maybe shows a small benefit. There is, of course, some data from To the Top suggesting that immunotherapy has a benefit when combined with Optune in GBM. That was a non-randomized trial, but that's the basis for the big EF41 study. So, you know, we know that Optune plus immunotherapy improves survival in lung cancer. So it might do in brain. Obviously, at the moment, access to immunotherapy for brain tumours in the UK is a bit difficult, and standard immunotherapy drugs don't seem to work for brain tumours. I have had discussions with CGAT about whether we could bring their vaccine to the UK, but certainly in the short to medium term, the answer would be no. It's just technically too complicated to do at the moment. All right, that was slightly off topic, but that's all right. Any other Optune related questions?
Yeah, no, so thank you, everybody. And thank you to all the speakers who have given up time today to come and present. And to everyone that's joined in, both in the room and online. It's really meant a lot. And yeah, we hope to see you again at this event next year. And please, please, please do fill out the evaluation form. I will be sending out another email at the end of the day with the evaluation form, and you'll get a reminder in a week's time. So please, so you don't get those constant reminders.
That's good. And then the only other thing, just to echo, thanks you all for coming. Those of you both in the room and remotely who are interested in being part of that plan to put pressure on NICE, you know, we're always keen to have other people involved. So come and talk to